Welcome to Senior Moments, the show where we talk about all things senior, the good, the bad, and the utterly ridiculous. Today I have with me Donna Mason.
Hi, nice to see you.
Nice to see you too.
Yes.
And Donna's going to talk to us all about how HICAP can help us during open enrollment for our Medicare plans.
Yes.
So
we are approaching open enrollment beginning October 15th and running until December 7th. And this is the time where people will want to review their Part D drug plans, as well as they can even sign up for Medicare Advantage plans during that time, or go from an Advantage plan back to original Medicare. So we are getting ready for that. And that is something that everyone should be doing once a year.
why is that so important?
Well, because every year the premiums can go up, as well as the drug formularies can change. So what may work one year with a certain drug may not work the next year, and they may find themselves paying higher prices. So we encourage everyone to review their plans yearly.
Well, that's a really good advice, because I know I wouldn't be happy if all of a sudden my drug plan went way up and I hadn't anticipated it.
Right,
So.
exactly. So that is what I'm here to talk about today. So I am from HICAP. I am a HICAP counselor. That's Health Insurance Counseling Advocacy Program. And I counsel out of the Sonora office off of Standard Road. But we do counsel out of different sites, and we do serve 5 counties. So Tuolumne, Amador, Mariposa, and Alpine, and Calaveras.
Okay.
Yes. So.
And when do you start the HICAP appointments?
They begin on August 1st at 8 o'clock.
Right.
We anticipate a lot of people calling on that first day because our appointments book up very quickly. And so we will be offering phone appointments and in-person appointments. We counsel out of course, the Sonora site, Calaveras Senior Center, Amador Senior Center, and Mariposa Senior Center. So we will be booking appointments for all of those sites through the Sonora office.
Okay.
Yeah.
Now, how do you contact the Alpine people? I thought you said you included Alpine.
Yeah, so Alpine County, we don't get over there as often as we'd like. We are planning an outreach there in October so that we can get the word out. But people from Alpine, we do have an 800 number that they can call, and we can do phone appointments for that part of the population. Since we do not get out there as often as we'd like to, we do not have a counseling site in Alpine County, but we can offer them phone appointments as well. So.
Okay.
Yeah.
What happens if I call and all the slots are already filled up?
If you call and all the slots are filled up, there are 2 other options that we offer, and one is sending you a step-by-step guide to review your plan on Medicare.gov using their Plan Finder tool. We can email that to people, mail it to people, or there's also just calling 1-800-Medicare. They are a 24/7 operation, and they're located on the East Coast, so we tell people to call maybe after dinner sometime, and that way the phones probably will not be as busy, but they do hire extra staff for open enrollment, so they can, if they want to speak to a person, they can call 1-800-Medicare and they can help them review their plans.
Okay.
Yeah.
What happens if I don't get around to reviewing my plan this year?
Okay, if you don't get around to reviewing your plan and you don't use one of those options, then basically you would not be able to change your plan until the following open enrollment.
Okay.
Unless you have Medicare and Medi-Cal, and they can change their plans once every quarter if they need to.
Oh my goodness.
Yeah, so that is the difference there, is that if you're Medi-Medi or Medicare Medi-Cal, you do have that opportunity to change your plan more often.
That's amazing.
Yeah.
So that's really good to know.
Yes, yes.
Are there a specific group of people who especially benefit from HICAP counseling?
Yeah, so I would say seniors definitely, people with disabilities, low-income seniors, because there are several programs that can help people with a low income. help pay their Part B premiums, help pay their Part D drug plan premiums, as well as getting discounts on medications. So there are they're called low-income subsidy programs for the drug plans,
Okay.
and Medicare savings programs for the Part B premium to help pay for that. So there are definitely reasons people should be calling us because a lot of people can qualify for those programs and they don't even know it. So
Can you explain a little more about the Part B savings program? Is that what you called it?
yeah, the Medicare savings program will help pay your Part B premium.
All right.
So if your income is at a certain level, there is an application for it, and we can help people fill out an application, or we can send them one, and they can send that in, and they should get a response in about 2 to 3 weeks whether they qualify for that program. And then once they do qualify, then their Part B premium can be paid every month. And this year it's $185 a month, so that's quite a savings.
Oh, absolutely.
Yeah, so we urge people to call us to see if their income is within that threshold, and then we can help them apply for something like that. And the same with for the drug plans, we can help them apply for extra help for their drug plans based on their income.
Okay. Now, regarding the drug plans, what happens? I turned 65. I don't have any medication, so I just don't sign up for the drug plan. Is that a good idea?
No. The reason being is that if you are not on any medications when you turn 65, you still should get a Part D drug plan so that you're covered. Because if you choose to sign up for it later on, a year or two down the road, longer than that, there is a Part D late enrollment penalty, and that's a lifetime penalty. So basically, whatever the penalty is, they attach that to the drug plan premium that you pay every month. And so we always tell people, even though you're not taking any prescriptions now, you have to think about the future, and hopefully not, but you may run into an instance where you're taking a really expensive medication and you're paying full cost out of pocket if you don't have that Part D drug plan. Some people have retirement insurance plans through a former employer, and if they have a creditable drug plan through that, they can opt out of a Part D plan. And if they should lose that retirement insurance, they have a special enrollment period to get a Part D.
Okay.
So there are some people that don't have the Part D because they're covered by another plan.
So if I was discontinued from my other plan, let's say I'm 70 and I don't know, the corporation goes bankrupt and everything goes down the toilet, then I can still sign up through Medicare and not have the penalty for the back years that I wasn't signed up on Medicare's drug plan?
Yeah, so if you lost your employer group health plan or retirement plan, it gives you a special enrollment period of 60 days to get a new drug plan or a Part D plan. And as long as that insurance that you had was creditable with Medicare, you can get that drug plan without a penalty.
Oh, that's good
because you
to know.
lost your coverage.
Sure.
Through no fault of your own.
Right.
Yeah.
That makes sense.
Yeah.
And I know that I this year am paying $1.84 for my drug plan. So last year I think I paid 40 cents a month. So it really went up. But
Right.
you know, I don't take any medications, but at least I'm covering with $1.80. And well, shoot, I had foot surgery and I needed, antibiotics for that. And so it kicked in there, and it was great.
It kicked in, and the plan that you have is the plan this year that had the lowest premium.
Okay.
And before that, you're right, it was 40 cents a month. So you can see how these plans change.
Yes.
And how the premiums can change. So that's why it's so important for people to pay attention to that. If they get any notices before open enrollment saying their premium's going to go up, they definitely need to give us a call, and if we still have appointments, we can help them. Otherwise, 1-800-MEDICARE is wonderful. I mean, they can go through the same thing that we would do over the phone with the client. So,
Oh, that's wonderful.
Yeah.
Now, in the past, and I not sure where we land anymore. There used to be an infamous donut hole. So can you
Right.
talk a little bit about that and where we're at with that?
Yeah, so the donut hole was pertaining to coverage phases in drug plans. It is gone now, and there is no donut hole. So there is a point where I believe the threshold is $2,000. If you reach that point in money spent on prescriptions, then there's zero cost.
Okay.
So now there is like a little ceiling, and if you go over that amount, then your prescriptions are zero. But there is no more donut hole. That was like a tiered
Right.
phase, and they did away with that. And that's a good thing because a lot of people were so confused by that. And so now it's just cut and dried. You reach the 2,000 mark, and there's zero. So
Okay.
yeah.
Yeah, obviously I brought it up, so I'm still a little confused about it, but I'm glad that that's no longer the case.
Yes, yes.
Gosh, my next question just went right out of my head. But okay, so I want to make sure I'm understanding correctly. I go and I fill a prescription, and I think the copay was a whole $8 for the antibiotics and stuff they
Right.
gave me after my surgery. I was like, $8, wow.
Yeah.
Okay, can't argue with that.
Right.
So that $8 would go towards the $2,000 cap.
Yes.
So it'd take me a long time to get to 2,000, but if I'm only paying $8, I'm not worried about it.
Yeah, chances are that is more so for people that are taking really expensive prescriptions.
Okay.
And they can reach that 2,000 pretty quick if
Yes,
they're on
absolutely.
the expensive medications. So yes, in your case, no, you would never, you probably won't even reach your deductible in your drug plan either.
No, probably
Yeah,
not, but
yeah,
that's
so
okay.
That's okay. That's a good thing.
It is a
Yeah,
good thing.
yeah,
I'd rather be
yeah.
healthy than
Exactly.
Yes,
Exactly. Yeah.
absolutely.
Yeah.
So I get information every once in a while about Medicare fraud. Is there anything we need to worry about with that from a consumer point?
Yes, so there are a lot of frauds and scams regarding Medicare going around. I just had somebody last month that said he got a call from someone saying they were from Medicare and that they were sending him a new card, but they asked for his Medicare number.
Oh boy.
He did not give it to them, but Medicare will never call you out of the blue to ask you for your Medicare number. They've already got it.
All right.
And the only reason they're going to be calling you is if they're returning a call that you placed and you had to leave a message.
Okay.
So we tell people just be very careful. Do not give out that kind of information. Don't give out Medicare numbers over the phone. Maybe just hang up if you're not sure who it is. Or you can say to them, well, what is your callback number?
Right, that's a good
And chances are
idea.
they're going to hang up because there is no number that you're going to be able to reach them at. It's not Medicare, that's for sure. So we just tell people to really be careful. Check those Medicare summary notices that you get showing your doctor visits and services that you receive. Make sure they match because sometimes there are even honest mistakes on your billing where something was
absolutely.
coded wrong and it's getting kicked back by Medicare and they're saying we're not going to cover this. Sometimes it's a coding error, but sometimes there are things that don't make any sense, like a doctor that you have no idea who that doctor is.
Right.
And so we tell people to always check those notices. Don't just put them in a pile somewhere and say you're going to look at them later. Maybe just check them as soon as they come in. So, but we do have, if you do think you're the victim of Medicare fraud, we have the Senior Medicare Patrol number that you can call, as well as they can place a call to us at HICAP and we can put them into contact with the right person to talk to. But yeah, main thing is don't keep your Medicare card with you. Don't give out any kind of information. And beware of salespeople calling you as well, trying to sign you up for Advantage plans that may not work in your area.
Right.
We get a lot of that. So people will sign up for a plan because it sounds good, and then they find out their doctors don't take it.
Right.
So yeah, so it's just you just have to educate yourself very well on those Advantage plans as well, because people will get bombarded with sales calls, especially during open enrollment. But I'm hearing all year long people are getting calls from salespeople because once they have your number, seems like everyone calls. So,
That is true.
yeah. Yeah.
And I always look at the caller ID before I answer the phone. Well, the other day I got a call that said Sutter Health, and it
Okay.
turned out to be a solar company trying to sell me solar panels.
Wow.
So now you can't even count on that.
No, you can't. Now,
Yeah.
I had heard, of course, the area codes, even if they're somewhere else or even in another country, they can use the 209 area code or whatever it is
Right.
that pertains to you. But I had not heard that the actual, it comes up on the caller ID, they can make that.
Yeah, I've never had that happen before, so I was a little amazed.
Okay,
yeah.
I'm gonna have to, I'm gonna bring that up to my program manager because we may get some calls like that too as well.
Sure. Well, speaking of calling, so if I call you, I've never talked to HICAP before, I pick up the phone, what's going to happen?
So basically, we'll ask you a few questions. Obviously, why you're calling, what your situation is. Everyone's got a different situation when they call us, and then we can build you a profile in our database. So we'll ask a few more questions.
Okay.
Get your profile built, and then we can schedule an appointment for you to come and sit down and talk to a counselor or a phone appointment. Some people prefer even post-COVID having a phone appointment because everyone's gotten used to that, and we can do the same thing over the phone.
Sure.
So basically we just kind of build that profile, schedule that appointment, have you speak to a counselor, and then go from there.
Okay. So what kind of documents or prep work should I do before I have my appointment?
So if it's an open enrollment appointment to review your drug plan, you would, whether it's phone or in person, you want to make sure you have your Medicare card.
Okay.
And if you take prescriptions, the bottles. So we prefer, whether it's phone or in person, to read off of those labels or have you read us the label because it's got all the information we need. Sometimes if people prepare a list ahead of time, it's missing something.
Right.
So yeah, so that's what we prefer. For the open enrollment appointments for Part D, that's the two things that we need, the Medicare card and the prescriptions in the bottles. For any other type of HICAP appointment, if it's to help choose a drug plan when you're new to Medicare, same thing, Medicare prescriptions. If it's a billing question, of course, any bill that you have a question about, we ask you to bring.
Okay.
So the more information, the better. So it just depends on what the situation is. Yeah.
All right. Now, do you offer Zoom appointments, or is it just strictly the phone call?
We just have the phone call right now. We don't
Okay.
have the Zoom appointment. So yeah, so it's either phone or in person at this point.
Sure.
Yeah,
Sometimes it's just nice to see the face on the other end. That's why I asked.
Exactly,
Yeah.
exactly. Yeah, we haven't gotten to that point. Who's to say maybe someday it'll be that way, but right now, no. Yeah.
Well, it is a little bit complicated to set up a Zoom appointment.
It can be.
yeah.
It can be. We do a lot of Zoom meetings, of course.
Right.
And sometimes there are technical difficulties with those.
Yeah.
So.
So probably just best to stick with the phone.
Yeah,
Yeah.
yeah. And we got so used to doing it during COVID that honestly, people at first were not that thrilled about having a phone appointment, but now people will say, "Oh no, that's the only thing I want is the phone appointment. I'm fine with it."
Oh,
it just took some
absolutely.
getting used to. So yeah.
Well, and I don't have to drive to see you. I can just do it from the comfort of my home.
Exactly, exactly. So yeah, so all we need is just for you to read the information to us, and we put it into the Medicare Plan Finder on Medicare.gov, and that's what we use to review people's plans. And that step-by-step guide, if somebody wants to do that, they can review their own plan and make changes if they need to as well on Medicare.gov.
Okay.
Yeah.
So is there anything that we haven't talked about that you would like people to know, or anything you want to emphasize that you want them to make sure to remember?
Yeah, I would say the main things are remembering every year to review your drug plan. Also, every year around your birthday, if you have original Medicare, you should be reviewing your Medigap policy as well.
Okay.
People are getting notices their premiums are going, they may get a notice their premium went up $50 a month. So that time around your birthday is the time to review that Medigap supplement because You have 60 days from your birthday to make a change without insurance underwriting. So that's another thing a lot of people aren't aware of, that they can also change their Medigap policy without insurance underwriting. So say State Farm has a cheaper rate than AARP, they can make that switch during that 60 days from their birthday.
Okay.
And then my other thing would be for people when opting possibly to sign up for a Medicare Advantage plan, that they make sure they do the homework ahead of time to make sure their doctors and hospital take that plan so that they don't have any surprises if they do enroll. The Advantage plans, the big difference we tell people between that and original Medicare is the Advantage plans have copays, prior authorizations for procedures, and making sure your doctors and hospital take those, because there are, in some counties we're finding, people are telling us their doctors don't take them.
Okay.
So while it may sound good up front, you need to do a little bit of research and work to determine whether that's going to be right for you. We can give people the details of those plans and the information.
Okay,
But
good.
they will need to make sure their doctors take those plans. So
Yeah, it's not a really effective insurance policy if you can't get anybody to take it. So
exactly, or if you have to
Yeah.
travel.
exactly.
You know, so, and that's the thing, you know, when people get up in age, traveling further away to a doctor's appointment just doesn't make sense. So, yeah, we just tell people, you know, just research, research, research. So,
That is good advice,
Yep,
and I
yep.
will take that.
okay.
All right. Well, I thank you very much for coming today. It's been really enjoyable talking to you. It's been
Thank
fun and very informative. I hope it's been informative to our audience as well. Thank you for joining us, and please tune in again next time.